Welcome to Kind Inside the Facial Room, a podcast where we explore the deep connection between your skin, your health, and your story. I'm Danny, a holistic facialist, and in this space, we go beyond the surface. You'll hear real conversations, healing insights, and the soft hum of skin rituals unfolding in real time. This is your invitation to pause, drop in, and reconnect with what's truly nourishing, inside and out. Welcome back to episode 4 of Kind Inside the Treatment Room. Today we have a wonderful guest, Peter, who owns Holistic Minds, Holistic Body. Peter is a Chinese medicine practitioner and he's also an acupuncturist here on the Gold Coast. Peter, how are you?
I'm very good, thank you.
Good. Now, this is your first ever facial, correct?
Yes.
Yes. What are you looking forward to the most?
The relaxation, Chinese skin,
Perfect.
looking Chinese.
Excellent. We can do that for you. So as I mentioned, you are a traditional Chinese medicine practitioner here on the Gold Coast and an acupuncturist. How did you get into that field?
Well, I actually started as a naturopath. My studies commenced in naturopathy, but I honestly couldn't see myself sitting down from a clinical perspective. Like I thought to myself, I needed to keep moving. And so there was a point in time during the course where, although I loved the course, some teachers were boring. I wanted something that I could stick to potentially for the rest of my life. And so then I was lucky enough to encounter a few Chinese med acupuncture students and pick at their brain. And I was able to ask them silly questions like, I guess most people assume about acupuncture in the Hollywood movies. And if one could put like a special point and kill someone or free someone, and obviously they laughed at me. But they said, no, it doesn't really do that. And it's obviously a Hollywood sensation, but it can do A to Z. And when they told me the A to Z, I was just, my mouth sort of dropped. And so I sort of had to see it for myself. And then I jumped into the course and I just fell in love with its philosophies, the idea of like moving around, being a bit more hands-on, as well as, really integrative in the approach. And I fell in love with the teachers as well. And I've just honestly never looked back. Every year I practice, it's 14 years. I seem to fall more in love with the medicine because it's such a special, holistic approach to healing people.
I love that. That's really beautiful. With Holistic Minds and Holistic Bodies, it's a sanctuary for people on the coast where people can come to heal. What are the type of things that you treat and what are the modalities that you use?
So the main thing that people come to see the clinic for is anything relating to women's health, particularly surrounding endometriosis, adenomyosis, PCOS, generalized period pain, and anything to do with TMJ, jaw issues, and complex pain. So it's quite niched. And in particular, a lot of the TMJ and the overlap between TMJ syndrome and endo TMJ syndrome, and what we're seeing is mast cell activation syndrome. So it's quite a niche area that I treat people, and I'm very fortunate that people come and travel because of what I offer.
That's incredible. I never really delved down that path of knowing that TMJ was obviously related to mast cell activation issues, things like that. Obviously, it is related to a lot of pelvic floor issues, which is so fascinating. I myself treat TMJ issues more for pain relief, whereas you go 10 times more further and deeper into it than I do, obviously finding the root cause of it, which I love. So what type of modalities do you use within your clinic to help treat that?
So primarily acupuncture and a Japanese style of acupuncture, which is super gentle. So it's a style of acupuncture that came from Japan that evolved from the traditional Chinese. So it still has its roots in the Chinese style of acupuncture, but the needling is a lot more superficial. And it's amazing for those who suffer from those complex issues like the mast cell, the POTS, the EDS, nervous system dysregulation. And then we move on to things like Chinese herbal medicine. And because of the background in naturopathy, if I need to, with the women's health and TMJ overlap, we're going to be testing a lot of their blood work. I've got a lot of really good doctors who are aware of what I do. So it's really easy to link my patients up with doctors or professionals to get additional testing. So this might be, functional stool testing. This might be comprehensive blood work to see where their histamine levels are at, zinc levels are at, B12 levels. all the things that I look at to say, all right, cool, what else is driving their TMJ, nervous system dysregulation, or whatever else they're seeing for.
I think TMJ has definitely exploded onto the scene of late. Like, it has become extremely popular. Whether people have been suffering for this for decades, just unknowingly. But what are all the drivers that cause TMJ?
I'm gonna try and name my top 5
Go for it.
because the list is too big. One of the biggest ones that I see, I'm gonna go with number 1 would be the facial structure. So I think a lot of my patients, including myself, have had things like braces when we were younger. It's very common for us to get teeth extraction to make space. And that's really changed the size of our palate and narrowing our faces, which has changed our airways and changing the way we breathe. So it's made a lot of people predominantly mouth breathers, particularly at nighttime, which is going to put a lot of pressure on the TMJ, alter the person's bite, change the way the teeth erode and open them up to cavities. So I think the changes through manipulation, through orthodontics was a big player. Further to that, I usually look at if people were breastfed or bottle fed, because the way that a baby breastfeeds and presses the nipple against the soft palate actually helps form the palate and widen it to give space for the teeth compared to bottle feeding. And I know not every female gets the chance to breastfeed, so there's no judgment there. And of course, things like your allergies and adenoids and chronic tonsillitis. So if there's been a child who snores, has had adenoids, has had a history of antibiotics, I can almost guarantee that they were a mouth breather as well. And this is going to lead them to nervous system issues and oral facial developmental issues as well. The second one that I see a lot of is that pelvic hip connection, where a lot of females come in with endo, period pain. Most recently, the best clue to that was everyone doing the Gold Coast Marathon, where a lot of females are doing the marathon and coming to see me with jaw pain because they had a lot of dysfunction in the pelvic floor, a lot of instability in the pelvic floor, which caused tightening of the pelvic floor. And the pelvic floor is connected to the diaphragm and the jaw. So they're the 3 diaphragms of the body, which if you don't untense one or create function, the other one will compensate. Another reason that I see people is the rise in mast cell, POTS, EDS, and they all come under a umbrella known as dysautonomia, and particularly after COVID and how the spike protein behaves. You have sensitization of the mast cells, which release a lot of histamine and other neurochemicals that irritate the body, the immune system, and put people into a dysregulated state, which leads to a lot of clenching, grinding, and people cracking their teeth, and of course manifesting that TMJ issue. And I think that especially after COVID, aside from the virus, I think so many people are overwhelmed, overstimulated. So we're all suffering from this like FOMO and behaving in this fear of missing out state. And so, we don't get off our gadgets and we're always stimulated. We go home and we try and regulate ourselves with Netflix. And we never really drop into that really restful sleep, which then leads to that dysregulation, generalized anxiety, chronic anxiety, panic attacks. And I'm seeing a lot of my patients, not to mention all the economic things happening where people are really struggling just to pay their rent. And we're seeing the inflation in the Queensland housing prices that's just stressing everyone out. And I'd say the last one I see a lot is burnout, in particular in the postnatal phase of mums. So there's not enough information on postnatal depletion. A lot of people are aware of postnatal depression, but postnatal depletion needs its own airtime, where a female is simply gaslit because she's an anxious mom, and that moms should simply be anxious and tired because that's just how, women are. And it's just natural to be chronically exhausted. But when we do their blood tests, we see massive dysregulation. We see iron deficiency, B12 deficiencies, all the things that cause clenching and grinding.
To summarize with that, there was a lot of great information there, but a lot of issues stemming from childhood.
Yep.
And then obviously we've got hormonal issues. We've got autoimmune disorders. We've got stress, nervous system related issues. Is it also like postural and structural issues as well that you see?
I do see things like neck, shoulder, and hip as a dysfunction driving jaw issues. So primarily we'd see this in a lot of people that go to the gym and don't have stability and strength through the hips and their shoulders. Their bodies will naturally clench. And then, of course, you've got, the people that work in an office doing 8 hours or doing the drive to Brisbane, working at an office where they've got that forward head posture. But when it comes to posture, I don't obsess with posture being the be all end all, because I think that's where the nervous system comes in. I'll always use analogies with people where you might have a hunched over presentation but be asymptomatic, but then you've got person B who has a hunched over presentation but they're in agony with their jaw, neck, and shoulder. And that's where that nervous system dysregulation comes in. Person who's happy go lucky, has had a really good upbringing, a really good way of adapting to stress, can have a really good, really like shocking posture, but have completely no symptoms of pain. And I see this all the time in the clinic.
Okay.
Versus other people, I think, hyperfixate on the posture. And I think it's an important thing, but more important is to focus on how the brain is perceiving that posture.
And as you mentioned before, with the autoimmune disorders, you've got POS, you've got EDS, which is the Ehlers-Danlos syndrome, I'm sure you're talking
Correct.
about. Yep. How is that connected to the jaw?
Well, when it comes to EDS or anyone who's got hypermobility, your nervous system reacts in a fight and flight response. So when people were younger and they could do the splits easier, they can contort themselves, and it's something that I look at in adults and then have a discussion if they've got young adults, particularly females. I always use the same: an unstable joint becomes an unstable brain, which becomes a stressed out brain. And then you get a lot of clenching and grinding if there's a lot of instability. I see this again commonly with young females who have that hypermobility, EDS, and hyperflexibility, and they play netball or sports where they're always rolling their ankle. They are an anxious mess in spite of not having the emotional triggers. They have the physical triggers that cause them to clench and grind and be dysregulated.
A neurofunctional and holistic approach is what you offer to jaw pain. What are some of those approaches?
I think for me, it's just doing a thorough assessment, doing like a bit of a checklist to see, all right, cool, what is this individual person's driver? So checking stability and strength of their joints, so hips, knees, ankles, and shoulders primarily, as well as thoracic, cervical movement, range of motion. Then we're going into looking at potential stresses to the nervous system that a person might not be aware of, that might not be emotional. A really good case study that I could share would be this absolutely lovely lady who had right side jaw pain, right side stiff neck, and right side trap pain. And this is where we had to use that neurofunctional approach and think outside the box. But I noticed during a consult that although she was getting better and better, we couldn't really figure out why it kept coming back until I realized that she kept poking out her right ear to me. And this case, the individual was 65, and I'd asked her, I actually said to her, do you mind if I ask you a question? And she didn't mind. And I said, are you supposed to be wearing hearing aids? And she said to me, yes. She's like, I'm supposed to be wearing hearing aids. And I said, you haven't been wearing them the whole time. And I said, do you wear them at home? And she's like, no, because I'm embarrassed to wear them. So she was always poking out the right side of her neck in an unnatural way. And so number one, this is an unnatural way of obviously having her posture on a constant basis to try and hear people. And number two, I was also teaching her about the fact that if sounds are muffled, her brain is going to be perceiving everything as a threat. So her tension was because she couldn't hear things, because her brain couldn't tell where she was. And, whether that was like a tiger in the background, was it a robber in the background, or was it a family member, because everything was muffled. The moment we treated her and got her to wear her hearing aids, after a couple of weeks, she never had neck pain, jaw pain, tension, everything just softened.
Wow.
And I bumped into her, and she's wearing her hearing aids, and she hasn't had pain, headache, migraine ever since.
Do you feel that the body, I guess, stepped out of that fight or flight response? Because then it could obviously understand the danger, like what
Absolutely.
was the danger? Yeah.
She could hear.
Yeah.
And the same thing happens with glasses, when sometimes I have to pick up on the fact that people can't read properly, so I'll get them to get an eye check. Or I'll get them to do eye exercises. So when we're looking at a computer and a phone, we're only looking in a short-sighted manner compared to looking at the distance, which we rarely do anymore. So if we're looking in a contracted state, the eyes are connected to the back of the head from a muscular perspective. So it creates a lot of tension, creates a lot of referral pattern into the jaw. So I'm always asking people if they need to wear glasses, if they need to get it mended, because it's all part of looking at how the brain and the body are interconnected, how the brain and the nervous system are firing off to a perceived threat. Because something that looks blurred will also be a threat to the body and the brain. Until you correct that underlying issue, the person's always going to be clenching and be in pain.
I love that. It's just I can see why so many people come to see you. It's just your brain is full of all this amazing intellect and knowledge. I just want to get in there and just source all through it. TMJ has become quite the hype lately. And for those that don't know, TMJ is the temporomandibular joint. It just connects the jaw to the skull. Why do you think there's such an influx of people at the moment with TMJ issues?
I think the clenching and grinding, particularly again with post COVID, has become a big thing where people are unfortunately, with the previous history of the orthodontics shrinking their mouth, whether it's having soft brittle teeth. I think there is advances in dentistry and physio that's diagnostically picking it up a lot more. And so we're seeing people that, classically the treatment would be either Valium or Botox. And where not everyone wants to get Botox or there's natural side effects to it, people are now seeking alternative routes to get down to the root cause. And that I think is a big driver of issues. And then you've got the rise in social media. So if we go back 14 years when I started, it was through word of mouth. And now we have social media. We're getting a lot of really good airtime for people to start thinking, cool, is it normal for me to wake up with a headache? Should I be doing and investigating what that's really doing to me and how that's affecting my quality of life. And I guess that's the good thing with the social media is that sometimes people come to my clinic and they'll often say, look, I didn't even think I had a TMJ problem until I clicked that I was getting headaches every morning. And it's something they just got used to. They would get up, have a headache, have a glass of water, and have a Panadol.
Mm.
So having that social media that now allows us to communicate this information at lightning speed compared to 10 years ago is going to be a massive driver, and the upskilling of a lot of dentists and physios diagnosing people and also acknowledging that a lot of TMJ disorder comes from, bruxism, clenching and grinding from stress. And as much as physios are phenomenal at a lot of the mechanical dry needling, a lot of them are acknowledging this biopsychosocial driver of jaw and the emotional states and how it's driving a lot of diseases and in particular TMJ dysfunction.
You're definitely right there. With the TMJ massage that I do within my facial, it's a sculpt and define facial. So what that means is that we're obviously lifting, it's anti-aging, but when I do the massage internally, obviously people don't understand who haven't had it before,
Mm,
how much pressure, strain, and tension they have around the jawline. So
totally.
it's phenomenal the amount of stress that we carry in that particular area of the body.
Oh, I just totally agree. That's why I'm passionate about, finding the cause as to, why that person is in absolute pain and then figuring out, cool, how can we switch off the alarms? How can we, navigate, whether it's the hearing aids, whether it's, changing the glasses, giving them eye exercises, or working on the internal medicine. So whether that's their endo, their mast cells, and their gut health, and figuring out, cool, how can we not just give you the relief locally with massa temporalis and everything else that's associated with the TMJ, but also permanently, or as close to permanently as we can.
You just explained a couple of things that people can do at home. Are there any other things that people can do, obviously, between treatments, between yourself and I, as to how they can help relieve the pain at home?
Oh, absolutely. A few of my favorites are things like your magnesium glycinate. So there are different types of magnesium that people need to be sort of aware of, but the magnesium glycinate is a great one because it is more relaxing, so it's more appropriate for the nighttime. It can be used during the day to help calm people as well. But the glycine in particular is a special amino acid that helps increase GABA, which is a relaxant for the brain, so that helps people feel a bit more chilled out without being sedated. My absolute favorite, because a lot of people come in with medications and you sort of want to give them things that don't interact and make sure that they are safe, is L-theanine, which is another amino acid that's so readily available. It's really easy for people to take at nighttime, doesn't interact, doesn't make them feel queasy, doesn't have side effects, and helps them drop into a deeper state of sleep and significantly reduce the clenching and the grinding. I'm a huge fan of mouth taping by reducing the chances of mouth breathing and going into a nasal breathing. We're oxygenating more. we're releasing more growth hormone, we're releasing more antidiuretic hormones, we're not waking up to go pee as much. And the flow-on effect to all of this is a more relaxed jaw as well. And it's a really, whether people get the bougie mouth tape, whether they just get a microporous tape and start mouth taping, it's always a phenomenal intervention. A few of my favorite teas are lemon balm, tulsi tea, and chrysanthemum tea. The first two are great for nervous system regulation and helping people feel a little bit more chill so they're not carrying the high cortisol into the nighttime. And the last one, which is the chrysanthemum, is great for gut inflammation, gut health, and histamine issues as well. So it's really going to clear up the eustachian tube. It's going to be an anti-inflammatory for eustachian tube. And it's going to allow them to breathe better, minimize their nose breathing, and relieve tension in their face.
What is a eustachian tube?
Our eustachian tube is a tube that carries a lot of our mucus from the sinus cavity to the ear and to be cleared out. And it can often be swelled when people get a head cold, when they get sinusitis. So when people get like a sinusitis attack or a flu, the eustachian tube will get blocked and congested and put a lot of pressure behind the masseters, behind the teeth. So very commonly people, when they get inflammation in the eustachian tube, they'll get ear pain, they can get balance issues, they get all the TMJ pain, but it's not a masseter problem. It's a problem with the eustachian tube being swollen, putting pressure on all the relevant structures that I just mentioned.
There's a lot of, I guess, issues now women have with obviously hormonal issues and TMJ related issues. Do you find women are more susceptible to TMJ issues than men?
Oh, absolutely. In particular, unfortunately, if females suffer from gynecological issues, if females have a history of PTSD, and unfortunately, as we're seeing the rise of as well, which is again gaining traction in the perimenopausal phase. So formerly we would only talk about when a female finishes menstruating, and then there was the menopausal phase, but now we're going into the perimenopausal phase where there's ebbs and flows of estrogen. And because estrogen has links to histamine, there can be a rise in histamine, anxiety, insomnia that gives rise to TMJ. And we know that statistically, there's a higher chance of females in the menopause suffering from TMJ issues because there are estrogen and progesterone receptors in the TMJ joint itself. So as their hormones drop, unfortunately, that joint will be prone to arthritic changes very similar to their hips and their knees.
That's genuinely incredible. There's so much related to, I guess, the women's bodies that we just don't know about, thinking that we're going to get TMJ issues when we go through perimenopause.
There's just the higher risk, but I think that's why I love my job, is really assessing people and seeing where they're at, not just with their jaw, and looking at, all right, where are they in life? Are they on the pill, the Mirena? Do they have a history of endo? And how can we use preventative care so that we don't end up with the extremes of locked jaw or needing surgery on the jaw, or making sure they're having, sufficient fish oils, flaxseed oils. And for the perimenopausal phase, I always recommend things like pomegranate and sage, which are hormone regulators. And if we can regulate the hormones in that phase, we can have a massive benefit to this bracket of females to avoid TMJ issues and overall just feel better. So did you say enzyme mask?
Mm-hmm.
Is that the one that cleans the pores?
Yeah. The way that works is you've got the pineapple enzyme in that mask.
The bromelain?
Bromelain,
Yeah.
exactly. So it helps to refine the pores by munching down on all the dead skin cells around it, but it also gets into the pores to help really clear it all out and mop off all the excess oil.
Oh, wow.
For your skin, you do have a good controlled amount of oil, but it's nothing too heavy. But in line with that, you've got just a little bit of sebaceous filament, which sometimes can look like blackheads, okay? So they're not into that inflammation point at all where they are a blackhead.
Oh.
But there is sebaceous filament in the pore that you can see.
So how do you get rid of that?
Do you have a skincare routine at home?
Yeah, I thought something. No, I've got an exfoliator.
You've got an exfoliator?
Yeah, so it's used once a week only.
Yeah, perfect. And moisturizing? Are you moisturizing?
Yep.
Morning and night?
Mm-hmm.
Yeah. And what about cleansing, washing the face?
I've got a separate thing that it's got like some sort of charcoal. It's like some facial.
So it's like a face wash?
Yeah, I do it every day.
Perfect. What I want you to do is do that for a little bit longer, okay? Mm-hmm. So spend a good 60 seconds really massaging it into the skin, And when you remove it with like an organic muslin cotton cloth, because that will really help to clean out the pores a lot better. A lot of people are so slap happy when they do cleanse. It's just a quick rinse off and then remove.
That's probably me.
It's a lot of people. With Chinese medicine, how is the jaw and the jaw tension interpreted energetically or meridian wise?
It's actually a really good question, and it's something that we call pattern differentiation. The first thing that we look at, if from a diagnostic perspective, is what meridians go through the face. And the primary meridians that are impacted when it comes to TMJ are the gallbladder and sangel and the large intestine. From an energetic perspective, if it's an individual that gets, one-sided headache, migraine, and TMJ, we are often looking at something known as the gallbladder channel. This often leads us to ask questions of, if they've had their gallbladder removed, if they have issues digesting fatty foods. From an energetic, emotional perspective, particularly with women, because the gallbladder is associated with the liver, we'll often get into questions of like how happy they are with life. Because in Chinese medicine, we don't just look at symptoms, we look at, all right, what's driving the clenching, the grinding, and what channel meridian are we finding it on, and what emotional, physical, or chemical states are creating dysfunction.
Perfect.
What's this cool thing?
So this is a meta sheet mask. So it's a biocellulose mask, and it's encapsulated with a lot of hyaluronic acid and peptides as well. So you'll just be looking baby soft and smooth when you come out of here. But it's a really good mask when we do exfoliate to put a mask on to rehydrate the skin. How does it feel?
Amazing. How often do you recommend these facials?
Facials, it depends person to person, but you've got a cellular turnover with your skin at roughly about 21 to 28 days. So every 4 weeks is ideal.
Does it make a difference in the summer because there's more damage from the sun, like from a facial perspective?
I feel like it makes more of a difference in the winter time.
Okay.
When the humidity drops, our sebaceous glands actually drop by 10%. So they don't produce as much oil. You've got less humidity within the air. You've got hotter showers. You've got heaters. Everyone's skin gets quite dry within the winter. So I find having facials really helps to just stimulate your sebaceous flow with massage. And then in the summertime, it can be more just about hydration because we do obviously lose a lot of hydration through sweat when it becomes the summertime. And if you can't get in every 4 weeks, I say to people, as long as you can get in one facial per season, and then we're treating that change every season. Are there any patterns in the menstrual cycle or hormone fluctuations that you've noticed relate to the TMJ flare-ups? So say different parts of the cycle, do you notice it flares up differently at different times of the cycle?
Absolutely. So the two main ones that I would see where a high amount of clients unfortunately suffer from would be the pre-period TMJ sort of flare, where they get a lot of clenching, grinding that they don't ordinarily do in the first part of their cycle. And the reason being is they might have poor detox pathways. So estrogen and histamine share an intimate relationship. Too much estrogen stimulates those mast cells to release more histamine, and then the histamine starts to stimulate the cells to release more estrogen. So you get this vicious cycle, which then leads to anxiety, jaw clenching, and pain sensitivity. And I'll often see that with the discussions that I have. So beyond the TMJ, they'll also get insomnia, they'll get panic attacks, anxiety, and some females will also get the associated sneezing, the sinus, and food sensitivities. And the other one would be with females who suffer from iron deficiency. So if they come into their period and they have a heavy menstrual flow, it's the exhaustion and that sort of burnt out feeling that they get in that first week of bleed that causes them to clench and grind. So it's more of an exhaustion, and the body is just clenching and grinding just to try its best to stabilize the body.
So on a personal note, well, I've got you here.
Let me go for it.
I always get what's been classed as hormonal headaches or menstrual migraines. Literally like day one of my cycle, it will always be there. And if it's not there, definitely TMJ, jaw clenching issues. And around the eye area as well, there's always a lot of eye pain when I wake up. Is that hormone related, do you think? Or hard to tell without a proper diagnosis?
No, so if it's the eye area that you just pointed to, it's usually an SCM muscle referral or suboccipital. So whenever people point to specific areas, they're often trigger point referral patterns. So treating the SCM, but the reason the SCM is tight and dysfunctional is often because in this case, you're having high levels of histamine that you're not clearing. So there's two types of migraines menstrually that will manifest. Number one is the high histamine. So histamine irritates the trigeminal nerve, which gives you migraine. And the other one is the sudden drop in your estrogen. So that's another really common one. And the sudden drop of estrogen brings with that serotonin, mood disorders, and a lot of pain. So it's figuring out whether you're a high histamine or a low estrogen type presentation. So we look at, if it's a sudden drop, we're looking at melancholy, sort of sadness, don't want to leave the house, compared to the high histamine type, which is anxious, insomnia, jaw clenching, irritable, breast pain, breast swelling, tend towards more loose stools when they get their period.
That makes a lot of sense. A couple of questions that came through on Instagram for the viewers. One of them was about histamine issues. So it's great that we've already spoken a lot about that. But they just wanted to know, like, histamines, where do they come from? Like, what kicks them off?
To keep it really simple, it's a neurochemical that comes from the mast cell. So the mast cells are all over the body and they're abundant in the face and the uterus. So once the mast cell detects, so say, an antigen like pollen, so that would be just a really classic example, it irritates the cell and the immune system reacts, and as a defense mechanism, it degranulates or explodes, and as a result, you get mucus, snot, inflammation, itchiness, and all those associated allergic symptoms.
And so why do some people obviously have high histamine issues or high histamine symptoms?
Number one is you can have histamine intolerance. So the way I like to explain this to my patients is thinking of a bucket. Histamines aren't inherently bad, just like any hormone in the body, but a dysregulation or too much causes a problem. With the histamine intolerance, we're thinking about a bucket. And in today's age, we're having too many good things. So a classic example is I'll have a conversation with people, and in particular pre-period, and I'll get them to drop their high histamine foods. So things like your strawberry, your spinach, your kale, your avocado, your leftover foods, your sourdough, your kale chips, your apple cider vinegar, your kombuchas, and people freak out because that's their bread and butter every day. They're having these foods, and so this bucket is full, overloaded. And when it's overloaded, you get all the associated symptoms. So simply managing it with a lower histamine diet in the pre-period area or a low histamine diet throughout the cycle is drastically going to shift those symptoms. And the more complicated one would be the mast cell activation syndrome, where the mast cells have been primed to pretty much degranulate and be sensitive not just to pollen, but just a number of different irritants that you weren't formerly. And that's a little bit harder because it's not just about clearing the histamine, it's about stabilizing the cells that release histamine, which is way more complicated. So a really good one for that I use for my clients is a supplement called DAO, something like astragalus. You've got N-acetylcysteine. Black seed oil is phenomenal because it doesn't interact with drugs and it stabilizes the mast cell. So the goal there is to work on the nervous system, the chemical exposures, and the excessive release by the mast cells. So that's why I said it's a bit more of a hectic beast.
What is a mast cell?
A mast cell is part of the immune system. So they're cells that normally are programmed to react as part of the immune system, but when they become hypersensitive, then we get all the associated symptoms.
And the next question that came through was about mold. So can mold be tested in the body? And also, if it can be detected, how can we eliminate it?
Mold gets really complicated. So I do get a lot of clients, especially in Queensland, especially after the cyclone now, that have had a lot of mold exposure. From a testing perspective, you can get some basic serum if your doctor is willing. Otherwise, you can go into the functional realm and you can get a nasal swab that they send off to a lab to confirm any four types of mold that exist. And traditionally it tends to be the aspergillus type that people are reacting to. That doesn't mean the other ones aren't there. And then you go on to working on the liver, the gallbladder, beneficial bacteria that isn't going to stimulate histamine. So we're looking at binders, clearers, and making sure that their purging abilities are open. So that could look like consistent bowel motions, making sure they're using infrareds while they're using binders to sweat it out, and then reducing things like your stress load so that we're not feeding into the cycle of stress and how that's affecting, the ability to clear mold.
Do you find that a lot of these home remedies that people can get over the internet, zeolite, charcoal, those sorts of things, do they work, or are they better obviously seeing someone who's a bit more well-versed in it professionally?
They can be a really good start, but I guess one of the things that I talk about on Instagram is one person's medicine is another person's poison. More recently, I've seen a influx of people, as we were discussing, why are we seeing more TMJ? And likewise, I said social media is a big player in that, but now we've got ChatGPT and AI to contend with. And so back to the charcoal and zeolite, a lot of people are plugging in their symptoms to ChatGPT. They're plugging in their blood work to ChatGPT. And ChatGPT can be a phenomenal adjunct tool, but not a starting point, meaning that if people haven't consulted with someone and they're just going to throw random supplements, a lot of these supplements have consequences. And it's clinical experience that tells people, all right, cool, this is normal, this is not normal. Seek medical help, or it shouldn't be doing that to you. Or you could be one of those 1% of people that has a rare genetic component that makes you more reactive to supplement X. So when it comes to mold, mast cell, and sort of those really complicated health conditions, I definitely tell people don't do it on your own, because you could do so much more damage than you could to yourself.
Oh, exactly. That's excellent advice.
So where you're massaging just then is the eustachian tube. It's a drainage pipe.
Yeah, it's obviously with, a lot of sinus issues, that would be why.
Normally people get sort of snotty and nasally and blow it out through the nasal passages. Any excess will start to go into the eustachian tube, and we sort of want to clear that through the lymphatics.
Yeah.
But if it doesn't, so that area that you're touching gets quite inflamed, and behind there is the facial nerve, the trigeminal nerve, and other nerves that people get pain where they think they have a tooth infection.
Yeah.
Or they'll get pain where they think they've got like a Bell's palsy or something like that, but it's all eustachian dysfunction.
So do you think that massage can help with sinus drainage, or is that just a bit of a fad?
No, definitely, yeah. I think
Definitely
like what
can,
you're
yeah.
doing as an example is phenomenal from a symptomatic perspective and relief. So whenever I see patients, I'll obviously do needles to try and clear it, and a little bit of like gua sha massage to help.
Yeah.
And then I'll send them home with like a similar routine. It's important to deal with, all right, cool, what's the irritant? It could be as simple as, people wear like really toxic perfumes. It could be an indicator that their antioxidant status is quite low. So I find a lot of my perimenopausal, menopausal clients start getting issues for two reasons. The decline in estrogen actually shrinks your eustachian tube.
Okay.
Which gives like rise to balance issues and more sinus issues.
Yeah.
And because you're getting older, your antioxidants are naturally going to decline. So they're more reactive to environmental toxins than they were when they're in their 20s. That's why I love going through it, because for me, and that's why I like the question of like doing it yourself. Like if you do the ChatGPT, or, even if you look at my Instagram, there's a lot of stuff where people can start, which is great, but you don't know which one is the best for you.
Oh, exactly.
So my job is to look at these complicated cases and be like, cool, what's the top 3 or one thing that you take to make life easier?
Yeah.
That we can create objective, measures around. So that's why that L-theanine and black seed are at the top of my list.
Okay, well, that's all the questions we've gone through today. How's your skin feeling, Peter? Soft? Nice. Well, what we're going to do is just say goodbye to everyone, and we'll let you enjoy the rest of your massage. How does that sound?
Amazing.
Perfect. Thank you so much for coming in, Peter. You've been a wealth of knowledge.
You're very welcome. Thank you for having me.
We'll get you back on soon.
For Peter's facial, we use the Mukti Organics range, including the Balancing Cleanser, the Resurfacing Exfoliant, their Enzyme Mask, Hyaluronic Marine Serum, and Vitamin C Serum, with the Marigold Moisturizer to finish off. Also in the treatment, we use the Ameta Skin Sheet Masks. If you would like to know more about these products or where to purchase from, please reach out to me via the links below.